Right. I'm excited to introduce our Direction Not Perfection community today to Kevin Day, pharmacist. I'm so excited to just kind of hit a topic hard today with Kevin. We're going to talk InBody, body composition, a lot more, but I was introduced to Kevin through my hormone clinic to go get an InBody scan. And this is what we will unpack for you today, why this matters, why it could be important for your health journey in 2026. And anybody who is local out of our listeners, Kevin is Cincinnati based. So we do have opportunity if you are local to go utilize his pharmacy, his services, and it's just been a delight starting to get to know you, Kevin. So welcome.
Thanks. I appreciate it. Happy to be here.
Yes, happy snow day. We're enjoying a warm house across the Zoom together, and everybody else is out fighting traffic at the moment. So we'll
Exactly.
take it.
Yeah.
Can you loop us in, give us your background, how you became a pharmacist, and then you have branched even more into your own little niche? So I'd love the backstory.
Yeah, sure. We'll do it fast because it could be a long story and no one
Okay,
really wants
the
it.
Cliff Notes, Kevin.
Yeah. So I grew up here in Cincinnati. My dad owned a pharmacy on the west side. He's Miami Heights Pharmacy, one of the pharmacies I now own. They
Mm.
bought the pharmacy when they were pregnant with me. So when I tell people that I've been in pharmacy my entire life, I mean that pretty seriously. We were around to help dad from a pretty early age. Certainly this time of year, I have a lot of memories of digging delivery drivers out of snowbanks and driveways as a child on my snow days to help dad out. So I've been in the community pharmacy space for a long time. I went to pharmacy school at the University of Toledo. Love Cincinnati, had to get away for a little bit. So went up to Toledo for school, had an incredible experience there. Pharmacy school is hard and pretty standard across the country. We graduate with a doctorate degree in pharmacy, so I'm a PharmD, and everything that you're learning in pharmacy school is how to be a medication expert on a team, whether that's in the community setting like ours or in a hospital or a nursing home. It's all about how well can you understand medications, how they work in the body, how they work with each other, and be ready to go off kind of into that space. I did not go off right into that space. So I went to DC next and spent a few years at a pharmacy association learning about how some of the best pharmacies in the country are operating to take care of their patients and learned a ton there that is very much shaped of who I am and what our pharmacies are. So I moved back to Cincinnati in about 2018, bought the pharmacy from my parents on the west side right before the pandemic. That was fun. And then expanded to our location in Glendale in 2022. So now we have the two locations, one on the west side, one north central Cincinnati. And we are trying to take really great care of people. And that's the whole goal. People ask, what are you doing? What's your niche? Like, what are you trying to be? We just want to be part of a community-based healthcare team where we're focused on patients thriving and pooling whatever tools we can to do that. So certainly my role and my expertise and my background is still in medications, and that expands very naturally into supplements and nutraceuticals because we're talking about mechanisms and interactions and dosing the same way, whether it's a prescription drug or something different. But also, as we're in a what tools do we have access to that we might be able to help patients with, and how do we kind of pull those together? So that's the easy answer.
Yes, it's a perfect answer. And thank you. I think that you're summing up really well my experience of walking through your doors. I think the average person is used to walking into like a Walgreens or a CVS pharmacy. I had no idea that there was this other option out there where it's like a much more personalized experience. And you even have like weightlifting equipment in your area in your office. Like it was just interesting to me. Like you do look at the whole person. It feels very holistic and integrative. And it was just unique. So
Yeah.
I love that piece of where you've gone.
Yeah. People ask me a lot of, is it hard to be a small business owner against like the big chains? And I certainly am competing with them, and I shouldn't dismiss that fact. But at the same time, they're doing something else, right? I mean, like what CVS and Walgreens are doing as a business is, and Kroger and Walmart and like everybody who's a kind of traditional retail pharmacy is trying to sell medications as in a volume-based manner, right? As fast as they can and efficiently as they can. We are trying to use medications to help take care of people, right? But it's just a different space. So I'm really
Mm.
glad to hear you say of it feels different. That's the whole goal. Like we want it to feel and look and be different. And
Yes.
certainly we're going to jump to the InBody, but the InBody and the weightlifting equipment is very purposeful of this is a different space, and we need to be talking about all the tools to get better, not just the ones behind a pharmacy counter, because there's a lot of things that we should be using.
And I love that you can have the whole approach, right? I think sometimes people go so far one direction or the other that it's just meds or it's no meds. And there really is this happy blending of like, how do we, to your point, get to our optimal self, our best, not just lifespan, but health span that we can really live healthy in these years that we're here. And
Yeah.
you can just tell that you're providing that. So, yes, let's niche down. We promised our listeners this InBody talk today, and we're early in 2026 right now, and I feel like everybody, of course, gets hyper focused on this. I really do want to be a better version of myself and bring in my health. And if anyone has lived anywhere on social media, or within certain doctors' offices, like this InBody scale is a thing. It is out there, and I want you to describe like why you have a like of this tool, who
Sure.
you think it's appropriate for, and we'll keep asking questions as you go, but let's start
Yeah.
there.
Yeah, sounds good. So an InBody machine is a body composition analysis machine that uses electrical impedance. It's a physics machine, right, with electrical current, in order to tell an individual what makes up their weight. So, like you said, a lot of times this time of year, people are thinking about weight and maybe setting weight-based goals. And in most of healthcare, we stop at weights and then calculate a BMI and don't go any farther of what does that 150 or 180 or 250 pounds mean? What is that? And how do we actually set real goals around it to be really focused on health? There are certainly many people who getting smaller is going to be something that is good for them. But we want to make sure that them getting smaller is not them just losing what skeletal muscle mass they have, and end up where they are weaker than they used to be. Yes, smaller, their BMI is lower, but they may or may not be actually healthier, and we're moving in that real direction. So the tool is from my somewhat well-researched perspective, and I will be very frank about this, we've had the tool now for 3 years, and I haven't followed the research to know if there's a better tool on the market today. Then it was the best tool on the market. They're the market leader, and the thing that matters here is how precise and how reproducible are the results to make sure that we're not getting noise when we think there's actually signal. So that's what we're trying to figure out, using these currents to be able to break down how much muscle mass somebody has, how much fat they have. Really importantly for the machine we have is where those two things are in the body, whether it's in your arms or trunk or legs, and then be able to track that over time and track that movement. So we started with the InBody tool, pretty quickly after the GLP craze was starting for a very specific reason. There was some evidence early, that as much as 30% of patients were losing a substantial amount of skeletal muscle mass, when they started on GLPs, like to the tune of as high as, for every 2 pounds of weight loss, 1 pound of skeletal muscle mass. So just in general, we want that number for somebody who needs to lose a substantial amount of weight to be like 25%, maybe might be skeletal muscle mass. It's really hard to protect all of it. So 1 to 1 is bad. And it was really hard to know if that was noise or if that was real signal, if that was real data. It was too early. But with these tools existed as a way to be able to help somebody say they want to go from 250 pounds to 200 over a year-long period, and they're going to use a drug to help them do it. I wanted to say, I don't really know what your weight goal should be. I want to make sure you are strong enough to pursue the goals that you want to pursue as you age, which requires skeletal muscle mass. So I want your percent body fat to come down, and if that means your weight needs to come down by that much, cool. But we have patients who are really muscular, and they have a number goal for a scale that doesn't really line up with what they actually should be doing because it's going to require them sacrificing a lot of muscle, and that doesn't make sense. So that's the genesis of us having the tool, right? Is there's a drug. So again, it comes back to we're a pharmacy. We talk about medicine, pretty much all the time. This class of drugs is really powerful and really important, for so many individuals for health. And we want to make sure that we're using it as best we can, and the tool just becomes a great way to monitor that progress.
This is why we can be friends, Kevin. I love how you just summarized that. I had a patient one time who had lost literally over 150 pounds and was what I would have called her most best fit self, running marathons, weightlifting, and her insurance still put her in the category of morbidly obese and wouldn't give her the like benefits of insurance that like those bonuses that you can get if and it was just really sad because you're like, there's more to this picture than that BMI, like you were saying. And how do we keep, with talks like this, keep shaping other individuals' thoughts around like what health can look like? Because smaller doesn't always mean healthier. And you said that so beautifully. So thank you for emphasizing that.
Sure.
And then I love that you brought in the GLP-1 because I was going to say that it was a great example of we are talking pharmacy, we're talking meds. And do you feel like a disservice is being done to patients who are being handed a med and they walk out the door and they never have that talk or that opportunity to think like, no, I have to be seeing my muscle mass?
Absolutely. And I think we now have data to support that claim that there's a disservice being done. The as more and more real life data comes out, especially in the semaglutide space, because we have just a couple more years worth of experience of it, and I will be stunned if the tirzepatide data is different. There is a big difference in body composition results at the end of the day, but some of the other like easier to measure health markers, cardiovascular disease, kidney disease, for patients who have coaching, have focus on skeletal muscle mass resistance training in using the drug, right? So I'm concerned, I think is a fair statement still, although this has changed a lot over the last couple of years. That's why I kind of am hesitant to be like on record of this is what I think today, right? Like this is going to
That's
continue
fine.
to
Yeah,
evolve because
2026.
yeah, it's evolved so much. But I do have concern about patients who have such easy access to these tools, without necessarily having kind of some of that wraparound care. So that's really the hole we're trying to fill, is the individuals who are accessing one of these medications, maybe through an online service that doesn't really require ongoing monitoring or work or even workup or education. And all of a sudden they have weight falling off of them, which can, might be great, but might not be. And we want to make sure that we are offering that here in the community to be able to help people, make sure that that weight loss and that, honestly, the money that they're spending is worthwhile, right? We don't want somebody ending up the technical term is sarcopenic, where they don't have enough muscle to do what they want to be doing. So we used to reserve sarcopenia for effectively HIV and cancer patients. That was like the only time it would come up. But I think we're going to have at least potentially a lot of patients who post GLP and GIP medications, especially as the new ones come out, in the next few months that are even stronger, where if they're not training and eating appropriately, right, protein is going to be a super important conversation. They're going to end up with potentially a diagnosis of sarcopenia, which is again like this wasn't a thing. It wasn't a risk. You couldn't get that frail. The easy way for someone who's not, in medical terminology is this is pretty serious frailty. So if you can't walk up a flight of steps because you don't have the strength to push your body weight forward, like that's a problem, right? And it's definitely limiting for where we want to be. It does not align with thriving, for our patients.
Oh, that's terrifying. I have not heard this information yet, and it does make sense. Well, I think we've all seen the person who's had like the fast weight loss, and of course it feels good for the moment. But I'm hearing this too, and I'm curious out of you, but it's almost like surgical weight loss that it has a honeymoon period where it works really well for maybe a year or two, but then there is like a fall off with the medication that you better have all your like lifestyle behavior changes with it to make sure that it's supporting the tool and it's only a tool. Are you seeing that with your patients?
I am, yeah. We're to the point now where we have enough experience to start to really see what the end of the curve looks like.
Mhm.
And I think it's certainly supported in the literature, but we're seeing now in real life of patients have a starting weight, relatively rapid. We don't want people to be too fast, right? But relatively rapid weight loss, and that curve just kind of balances out at some point. I will say is it's not uncommon when that point of balance out is goal, right? And patients are where they want to be, but oftentimes it's not either, and sometimes that's the goal was not set appropriately, right? I mean, I have
Mhm.
patients who I don't want to say are frustrated necessarily, but sort of frustrated that they're not at their goal. But their goal was like 45% weight loss with a medication that on average produces 15. And so I see them like, look, you got 25% weight loss and you're
Mhm.
stronger and you feel great.
Mhm.
How do we balance, that and make sure that we're helping patients set kind of real appropriate goals? But there is a I don't know if I actually want to claim that there's a ceiling effect on the drug, but I love your phrase of there's definitely a honeymoon period where like this goes really well, and patients tend to feel pretty good, especially if they're dosed correctly on the medications. Some of the side effects are tough, but their weight is falling off. And a lot of times as that's happening, energy is can be really good. It can be really bad, right? We have a lot of fatigue from the drug itself, but a lot of patients do report that they just feel great on
Mhm.
it. And and then that tends to slow, right? And they just kind of are setting a new baseline. I think from my experiences, those patients they are way better and they're feeling way better. They are not continuing to lose weight, but it's more common is that's okay because they're close to where they should be and not need this to continue to go for a lot
Right.
of.
And I'm just going to follow up with your feeling better moment. I'm having so many clients who like their aches, their knee pain, their back pain all of a sudden is disappearing. And it's just been
Yeah,
really cool to be like, inflammation must be really down.
absolutely. Yeah, their GI distress, stress levels in general. And then the nice thing, like again, I'm a pharmacist. We talk about drugs. I love taking people off of medications. And we're doing a lot of that with this, right? So people they end up with low blood pressure because they were hypertensive and on several medications to control it, and then their body is healing. And now we have too much medicine on board, so we have to drop those off. Every drug has side effects, whether we can perceive them necessarily really well or not. But I think some of the, wow, I haven't felt as good in years, is also taking less medications is part of that too.
Thank you. Yes, this is so good. And I'm just gonna hone in since I have like 10 more minutes with you on I feel like as like responsible practitioners for anybody who is having clients with again GLP, semaglutide, any of the I'm going to keep bringing it back to this InBody, being able to see our insides. I feel like that's so motivating. It's helping our conversation on bringing people just off a scale weight. So can I hammer you with a couple questions with the
Yeah, absolutely.
InBody?
Yeah. Yep.
Okay. One is setting appropriate expectations of like when somebody's about to come in and do their InBody, I keep hearing more and more about what time do we need to do it? Do we need to come in with or without food? Like, can you give us a little rundown of how you should show up to your InBody appointment?
Sure. I'll give you the best way, and then we're going to give you like how it's actually going to work in real life, because there's going to be a difference, right? So it's almost undoubtable that the best way to do this is to have one of these machines in your house that you can wake up, go to the bathroom, and get on. Um, but they're really expensive, right? So like that's not
Mhm.
actually a choice. There are options for home use that are at least reasonable, but we think that the difference in the quality of the consistency of the readings is important to move forward. So we ask patients to come early in the day if they can. We don't show up at 6 a.m. though. So, right, what does that look like is different for people. But earlier in the day is a little bit better. You just have less noise of what happens throughout the day. If you are a patient or a clinician and you've put people on scales at various points throughout the day, like weight changes a lot throughout the day. It can fluctuate as much as 5 pounds. So could be a real difference. From the food hydration kind of perspective, I think about it a little bit similarly to how we do ideal blood pressure work. I'm not convinced that food plays a huge role other than it's in your stomach. And so this is a weird space and it shows up as extracellular water, which is kind of noisy in the machine. So if it can be like right before you eat, that's probably better. Hydration status is we want somebody to be their normal hydration. That's kind of the best answer to that. So please don't chug a gallon of water right before you show up. We do ask people to go to the bathroom before they get on the machine. Again, we want to have as little noise in that extracellular water space as we can. So we ask people to empty their bladder right before they step on. And then the last piece is just like comfortable and loose fitting clothing. But there's noise potential from caffeine, exercise, all has an ability to change some of this. So when I have somebody come on for the first time, we're not going to be of like, oh, you just came from lunch and you had caffeinated tea, something. We're gonna like postpone this, right? Like we just talk of like there might be a little bit of noise in this data, and after two or three or four, you start to see of what was noisy and what was actual signal, and it from my experiences, it's coming out in the wash after a couple of them. That said, the InBody team has relatively detailed instructions of what you should show up with. So that information is widely available. Not overhydrated is probably the biggest piece. Empty bladder, no caffeine, not post-workout. Hence, the first thing in the morning would be ideal for most people. Just
Thank you.
hard.
Perfect summary and
Yeah.
perfect reality. Yes, you
Yeah.
live in the land of real and with real people.
Yeah.
So thank you for
Yeah.
that. But if you were able to show up at an earlier time and kind of hit most of those, how many months in between before you could see some realistic changes and you would aim for about that same time of day again next time you got it, if you can
Yeah,
again?
this depends a lot on what people are doing. So, somebody who's starting a medication, we like to have them back at the 4 week mark, which is roughly when you're going to be talking about dosing changes.
Mhm.
Because if somebody is dropping skeletal muscle mass in a hurry, we want to know about it pretty fast, so we can start to intervene pretty quickly. It also becomes a really great way to be able to have time for us to sit down with a patient and have the data to inform like what should we be doing next as far as a potential dose alteration or not. For somebody who is not going to use a medication to kind of have an accelerated weight loss, the flip might be of like somebody like me who's in a muscle gain journey, which is super important for so many of us. That same right, there's a risk of the sarcopenia and frailty thing from a drug-induced world, but also in a low quality food sedentary lifestyle world, like we all kind of have some of this risk. So like I'm in a trying to add skeletal muscle mass perspective. If, and this is an if, I get a personal trainer and really start to go hard at some point, that is relatively likely to start to change in a matter of a few weeks. And I think it would make sense for someone in that perspective to also be coming back and showing up potentially every 4 weeks or so. I think if it's shorter than 2 weeks, is you're more likely to catch noise than you are signal. And if you're longer than 3 months, is you have a risk of just like not seeing what you were supposed to see. So
Mhm.
we like the 4, 6, 8 week perspective for lots and lots of people.
Thank you. That's wonderful insight on that.
Yeah.
Yes. Um, if is there an in-home, you started to say this, but equivalent to the InBody where you're like, we get it, it's not as great, but if I were to get something in my house, what would be your recommendation?
Yeah, so that's the work I haven't done to give like any brand recommendation kind of things.
Hmm.
I do think having one of the machines that has handles probably is kind of like directionally a better perspective because all the machines are using electrical current and impedance calculations. If you only have touch points on your feet, it's going to go up through your trunk and back down, which means everything else is an approximation. If you have touch points through your arms, you're at least going, through your hands all the way through your trunk and able to kind of pull a little bit more data. The two pieces are, is the machine measuring accurately, which we're talking about variations in ones of milliseconds. I mean, just incredibly detailed kind of capture. So I think that's a fair question to ask. And again, I don't know. I'm
That's
not
a great
sure.
answer.
Yeah. And then
Yeah.
the second part of that, not only is it measuring it correctly, is the algorithm set up appropriately to then report results that matter. Um, that is the frustration that I have seen with some of people's home use. Like I have a patient who told me the other day that her home scale says that she's 22% skeletal muscle mass. Like, I don't, that is just not a metric that I've ever seen reported before, right? So I'm then like doing math, trying to figure out like what it corresponds to. So like that kind of stuff is weird. Like there's really well researched metrics in body composition. If your machine is reporting those, that would be better than if it's reporting almost anything else. And if it's reporting things that it can't actually measure and is not telling you pretty directly that these are inferred or imputed or calculated something, that would be a big red flag. So those are the two things that I see kind of on the risk side. But as far as like who's the best, like I don't know.
No, that's fine. Even just hearing out of you, like find at least a handheld with the feet, so it's going through more of your body. That's helpful. DEXA scan versus InBody has been a huge question because I do feel like people are more and more accessible to these DEXA scans to see body composition. What are your feelings?
A well-performed DEXA scan is the gold standard. So the InBody, everything about the InBody is based off of and compared to a DEXA scan. So if somebody has easy access to a DEXA scan, well done is really important. And talk about the variation of how you show up is even more picked up on DEXA. So there's pretty good evidence that not having the same person, the same ultrasound tech, do the DEXA scan time after time can create variation that is hard to like decipher again of what's noise and what's signal. So that is a challenge. And yes, they are more accessible, which is great for just to be, you may have talked about this on a different podcast, but there's kind of a bone density only DEXA scan, and then there's like a whole body composition DEXA scan. Make sure you get the one that you actually want. And you have to pay a little bit more for it. But I've had people bring their bone density only lumbar spine, and they're like, I thought you said I was going to get body composition out of this. And it's like, you didn't pay enough money. So just to, right, there's two different variations of what gets done at those clinics. But that is the gold standard. There's no, from my perspective, that's not a conversation. Again, the InBody team might want to argue it, but we're still in a space of the best way to measure body composition is a well done DEXA scan. Anything else is a reference on that, and that's fine. And we're looking to have products that are as close to those references as we can, but we should always know what the gold standard is that we're comparing it to.
Right. Yes, beautifully said. Okay, last one, supplement. As we're thinking, like we're trying to protect bone, we're trying to build muscle. I think protein's always thrown out there to the population. Do you have a supplement that you also feel is important to be part of this journey? These are client questions coming at you, by the way.
Yeah, sure. We definitely want to make sure people have protein on board to be able to reach whatever their goals are. So if their goals are protecting skeletal muscle mass, that's a different amount of protein than it is to build. And I love having the data is if you think you have enough and the data is showing something different, let's tweak it and go from there. On the supplement side, from a bone density perspective, we have the big like calcium and D, but for most women, we also like really need vitamin K2. And then there's a couple other pieces, selenium and a few others that some of the really well-built supplement brands have put together into nice, easy, like everything's here together. But from my perspective, it's K2 is the one that people miss on the bone side, but we've watched DEXA scans get better just simply adding K2 to a regimen that already includes enough vitamin D and calcium. So sometimes that's the missing link. Most of the time in supplements, and this is definitely one of those scenarios, is we don't know for sure which piece of the puzzle is going to be the piece that one individual is missing. So we're tinkering and trying one thing after another and looking for more data to figure that out. Or we're throwing everything, and that depends on kind of what the safety of what we're talking about is. If it's a safe recommendation to take all 12 pieces of the puzzle, we'll just give you all 12 pieces of the puzzle. But we might want to go one by one and try to figure out which piece is missing for you is maybe a better way to kind of get through that.
And this is why it's so important to be so individualized. And I've seen that you offer individual coaching in your office space, but do you also offer virtual if somebody who doesn't live in Cincinnati is like, I'd love to speak to Kevin?
I don't have a model for that at the moment, but I'm not opposed for somebody reaching out and figuring that out kind of on a fly. So we're balancing life is kind of the biggest thing. I don't know if you've heard my kids in the background of this conversation, but I have a 4-year-old and 6-month-old twins. So there's just a lot in the world. We
Yes.
love to do stuff face to face. That said, we certainly do a lot of work with patients, especially after we've met them face to face, where then we're doing work virtually. So there's certainly ways that we can figure that out.
Well, you are a complete delight and so much a wealth of information. Thank you for pouring your time and wisdom. You are a busy man, and we are spoiled to get you this morning. And lastly, I just like to wrap up with my guests. Like, if there's one thing that you could pour over our community, or you hope and pray that they heard out of you today, how would you like to leave us?
Gosh, I want to leave people with a challenge for setting really great goals. Almost for sure you've heard the phrase of a SMART goal. That's an acronym, but we also want to come back and make sure that it's actually SMART, which is not part of the acronym. So sometimes people set goals that they're like set by somebody else or they're coming down from the world, and that often is not a way to succeed and thrive. So how do we find goals that are meaningful for you as an individual? So for me, this time of year, it's a great reminder that I want to be able to ski when I'm 80, right? So that is I have to get stronger now because 50 years from now, I'm not going to be strong enough to do it unless I get better today. That becomes an easy and kind of flagpole for me. We want to find those kinds of things. So that is specific, but it's not timely, right? It's nothing of a smart thing, but it's motivating and that makes it valuable. And we want people to be finding those sorts of things this time of year.
Thank you. So inspirational. You're checking in with your 80-year-old self, and he will be proud of you
We'll
when
we'll
you're
find this video
skiing.
then and come back to it. So
Yes. I love it. Well, have an amazing day. Be safe on the roads, and thank you again for your time.
thanks, Lindsay. Appreciate it.
Mhm.